Hello everyone and welcome back. Today I will be joined by my colleague in pelvic health physical therapy, Jill Jennings. She is a physical therapist and owner of Hope and Light Pelvic Physical Therapy. She's passionate about educating women and I am gonna pull her in. She's here now. She's passionate about educating women in pelvic health topics and her favorite intimate rose tools. And if you have questions, please don't hesitate to ask them as we're going through. Hi, Jill.
Hi. Hi. So great to talk with
So
you.
good to see you. Thank you for joining me today. I was just telling them what an amazing pelvic physical therapist you are and that you're passionate about helping women. Do you want to tell us about your practice? Where are you located?
Yeah, actually, we are in Greenville, South Carolina, and I have just been in this private practice since June. So this is brand new as far as private practice to me. I've been a PT for almost 25 years and really started specializing in women's health in 2019. And I had worked with a fabulous local concierge and cash-based practice here in Greenville as well, and then decided to go out on my own. And so it's just about a month in practice here. So very, I would say it's a holistic approach to care, and I specialize in women, all ages, all seasons of life.
That's amazing. And congratulations on your new space. It's gorgeous.
Thank you so much. Thank you. It's, you know what? I'm going to unplug that light because I think it's going to keep doing that. There we go.
Oh, that's easy.
Okay.
So you treat all the wide variety of lifespans in pelvic health that can look very different in the teenage and 20s and 30s versus in perimenopausal and beyond. What is your favorite area to treat?
Oh gosh, that's so hard. I ask other colleagues that question as well. I really do enjoy, I would say, pelvic pain and sexual health, and that can mean a lot of different things. All the way from young women that are maybe newly married and expected sex to be a lot different than it is, and having a lot of pain and discouragement, or not knowing that it could be different for them, and giving them a voice to that and helping them have conversations with their partners and build some comfort level in talking about their sexuality. I love also perimenopause and menopause, because again, that's another huge transition that is just so dismissed. Is getting better, right? It's so fun to see all the attention. But I've definitely had clients in their 60s that say, like, I wish we had gotten education about this. I almost need like a new sex ed class like we had in high school to be able to talk about these things. So working with those populations are a lot of fun, because I feel that often we are the first ones to validate anything that they are going through, and to be able to say, like, yes, this really is an issue and it's something that we can help. And to be able to give them that time and space is really fun. And it's complex too. So I think I enjoy the detective work and all the medical systems and the nervous system, the mental health component that's involved. So this aspect of care is very collaborative.
Absolutely. And I read this morning, we've been doing a lot more work in the menopause space, and certainly people are advocating and providers are getting a lot better at helping to manage. There's something like 66 symptoms that are attributed to perimenopause and menopause, and that's a lot. And it feels like a brand new body that they don't understand. Like all of a sudden, like the controls are not controlling. There's brain fog, changes to the tissue, changes to the coordination system, and it's all very, very frustrating.
And I think a lot of times they're just told, you know, that this is your new normal. And how discouraging is that for the next 30 or 40 years? Or the intimacy and your sexual health is not important once you reach a certain age. And I mean, I'm sure both of us, so many clients that have come in that say, if I had found you a few years ago, or if I had known about this, like how much different things would have been. And it tickles me when I have people in their 70s that are like so excited about their sex life. Their partners are really excited about this too. So that to me is just as fun as a 20-year-old that's trying to navigate, you know, why sex isn't fun and enjoyable like they thought it should be.
Absolutely. I agree wholeheartedly. I think there's hope for a very very energetic future. So,
Yes. Yes.
and one of my favorite things about your educational content is you do such an amazing job of describing what dilators are and what they're useful for and how they can be implemented into plans of care. Do you want to talk a little bit about how you use dilators in your practice?
Absolutely. And I think that one of the reasons I made that video is because I got so frustrated with what I was seeing and hearing from clients. They were being given maybe a recommendation to go online, or they just kind of found it on Amazon to buy these dilators, or they were specifically told, go home and stretch, like really make room in those pelvic floor muscles, which I know is not what you intended with this approach either. So we talk about context and a sense of safety and how the muscles are really doing their job. I mean, so many times the pelvic floor is getting blamed for things, and it's not its fault, right? It's doing its best job. It's trying to take care of you. So we say we're really trying to recreate a sense of safety and connection in your pelvis with these dilators. So that's why your approach, the way in which you use them is so important. It is not like going and getting a Theragun and really working on your back muscles or, rolling out your IT band. These muscles have such an emotional connection, and just one experience with really painful sex or a bad pelvic exam can just set that feedback loop up in your brain for continuing to guard, and not respecting that boundary with yourself doesn't let you get anywhere using those dilators. So a lot of people just quit and they say, well, I tried it and my doctor told me about it, and they don't get anywhere.
Absolutely. I agree wholeheartedly. And I often say too, the pelvic floor is trying to protect you. It's got a very deep inclination that is involuntary. It just contracts when it feels like we are threatened, and that threat could be real or perceived as our emotions dictate to us, and our brain utilizes past experiences, and that's where breaking the cycle is really important, and really adverse to using the word stretch with the pelvic floor. I use the word mobility and mobilization and training, because oftentimes we're rerouting and training a new pattern of behavior. So sometimes I like to, it's really about having the pelvic floor relax when it's supposed to be relaxed, because it needs to also contract when it's supposed to contract. So the same way that some people, when they clasp their hands, clasp with their left over right, we're going to reach where
Right
it's
when
just,
they switch that up in yoga class, I can
yes. It's a new
very
pattern.
tricky. It is, yes, a new neurotag. We talk about like pain science and just like, let's help the brain associate this. And we try to have conversations if this is for sexual health, and it's not always. This could be pregnancy pain or other things. But if this is involving your goal of being able to have intimacy with a partner, we really try to bring them into the conversation. So even thinking about, let's hold hands and let's have a great kiss, but that's the understanding that that's kind of where that stops while we're working on these muscles feeling safe. So then every time somebody rubs your shoulder or goes to give you a great kiss, you're not immediately having that response thinking this is going to lead to something that doesn't feel safe to my body, not even cognitively, but just deep below the surface. So we bring a lot of education to the table. And I always have the client, these are my favorite. I love the feel of these dilators. They have enough firmness to be able to work on tension points, but I feel like they don't stick to the tissues, and they glide really well, and the colors are fun. They don't look scary and over medical to me, which I think is helpful too. So we always have the clients bring them in, and they're familiar at that point with maybe where their issues are, where their tension is. And so we find some of those trigger points together, and then we have them use the dilators in session to see, can we get that same sense of safety? Can you relax? Can you breathe? And it might be, starting with the smallest one. Like sometimes just even a finger insertion or tampon is really uncomfortable. So it's a huge victory just for them to be able to learn to relax and open and insert without pain, contract and relax, do some breath work. And that's a success. I usually have them set a timer. It's not a goal to all of a sudden I have to get to this next level and I'm going to just spend an hour of my life every day working on these things, because that gets really frustrating too if you set yourself up for some kind of expectation. So my rule is that you set your environment up in a relaxing context. You move your body first. So you do hip mobility, spine, stretching. Maybe you have a scent that's relaxing to you. Gobs of pillows. I have so many pillows in my clinic. So everything in your body feels supported and you play around with positions. And then you always start out with what works for you, what you feel successful with. And then you can try that next level. And if that's comfortable, that's great. But then the next session, you still go back to that easy one. So it's kind of like the gym. You're warming up. We had a great experience with that. It's not fear-based at all. And then we kind of nudge into that challenging size. But it's okay. I tell them, like, some days maybe you just had a bad conversation or you left a really stressful day at work and you have that stress response. You didn't fail. You're not starting all over again. So I think if they have that in mind, that allows them to stay the course and work with these, and they can have great results.
Absolutely. Everything that you've described is exactly how I educate as well. And it's so important about setting the intention and the environment and recognizing that those rough days do come up. And that's part of being a person.
Yes.
And it doesn't mean
Yeah.
Yes.
I think there's so much. We don't get so frustrated our ankles and our knees, but it's muscles, right? And I tell the people, it was like nobody just blames their knee and is embarrassed to tell their friend they're having knee problems and these muscles and tissue, but it just takes on a whole other connotation. So it's very easy to just want to give up in this process or feel a sense of failure and shame you really attribute to yourself, not to a musculoskeletal issue. And just making sure we're helping them to understand that and unpack that a little bit. I mean, that's why I love to collaborate with mental health providers and sex therapists. There's sometimes so many deeper layers to why you are experiencing what you are in your pelvic floor.
Absolutely. And no need for shame or embarrassment. It's a sensitive area, certainly, but it doesn't need to carry that kind of weight.
Right.
What are some of your favorite exercises to couple with dilator training?
I would say windshield wipers, adductor rock backs, anything that gets us down. Most people love those. They just, and especially followed with a thread the needle or anything for thoracic rotation, just getting a lot of blood flow to the area. And I usually give a lot of people options. I'm like, pick the ones that you like. Like, we're going to discard the ones because the best exercise is the one you're going to do. So we can have options, and that is okay. Or go for a walk. Take a hot shower. We need movement, and that movement, that also helps set your mind too. You just get a little bit of that mood boost from that. And it is challenging. I think carving out the time, especially if we have clients that have young kiddos and a busy household and your children are in the bathroom with you and trying to find time to use your dilator. So we have to be kind of creative and strategize it in a way that can make this a good experience for everyone.
Absolutely. And sometimes it's very early and sometimes it's late and sometimes it's locked in the closet.
Yes. Absolutely.
It's a sizable closet, but that is where the dilator training happens. It doesn't have to be in the bed.
I have recently, since you came out with the vibrating dilator, which I just have the regular one here too, but we have had some really good success in having clients get both for external stimulation to get blood flow in the area. Again, something that feels good, because we're also exploring areas of pleasure or touch that feels okay. It's not all about penetration and rushing this, because a lot of times that's how sexual health is defined. And so using that wand externally for the vibration, the blood flow, or just barely entering in those superficial levels, then using your dilator. And clients have really enjoyed that too.
Yes, it's been a game changer. The vibrating wand has been so helpful physiologically, and I think mentally. There's something very interesting about vibration, and the vibrating wand comes with 10 frequencies, so people can self-select as to what's soothing for them and their nervous system. So I absolutely agree. Having that used before dilator sessions is really helpful.
I think the fact that it can be external as well lets you ease in. And then the more positive experiences you have, right, we get that rewiring. Then the brain's like, oh, wait a minute, that might actually be okay. I might enjoy that, or that feels safe to me.
Yes. And that's a big key component is we're going from pain and not being able to do major life activities, including intercourse, having a medical exam, to tolerating, which is like a C minus, like we're fine.
Best, right? Yeah,
Take that
yeah,
pleasure, which
yes,
is enjoyable and life giving and cup filling and all those
yes.
good things.
Yeah,
Connecting.
we always say not tolerable is not a great, like, let's try to raise that bar, like pleasurable and pain-free intimacy too, and not just always calling it intercourse. I think is something helpful, and that's fabulous if that's your goal. It's not everyone's goal with these dilators, and we use these too. These are fabulous in pregnancy. They can be great postpartum for perineal massage. So I feel like they can run the gamut for all the clients that I have.
I love it. Absolutely. There's many different applications, and it doesn't have to be penetrative intercourse. For some people, their goal is to have a pain-free medical
Right.
exam. And that's great. And we are so happy to help with that.
I had a client that I had seen maybe 6 to 8 weeks or so that had such a long history of pelvic pain, and they took a surprise trip to the beach. They didn't plan on it, and she got her period. She's like, "What am I going to do?" And she came back and she showed me her purse, and she just grabbed a bunch of tampons and threw them out in the desk. She's like, "I wore these." And she got to swim with her family. She had not been able to have tampon use in years and years. And just people don't understand what that small little, it seems small and irrelevant. And a lot of us, that's just, it's not an issue for us. And so being able to have those victories, I think that's what an aspect of women's health that is just so cool, because these are major quality of life issues. So every time I see a tampon, I think of her.
That's amazing. It is. It's one of those conveniences that we take for granted when our body allows us to do it. And when it doesn't,
Right.
it's really devastating. It can really change your willingness to want to go do certain things and participate in some things in life.
Yeah, absolutely.
Oh. What else would you like people to know about your practice?
I think there's just such an understanding of what pelvic health is, and sometimes a very narrow definition. I treat so many orthopedic conditions because that's the driver behind it. So, I mean, this week I had like a wrist and a neck and a big toe. If a big toe doesn't move and you're trying to run, right? And we're talking about ankle stiffness. Like that, your pelvic floor is not the main problem here. Like, it's just getting annoyed at all the slackers around it. So if we can figure out how this whole system works together, and that's really fun too, because my background started out in manual therapy and ortho, and I never have to put those hats away. I just have all this really new, cool way of integrating everything in. So I love that, because I feel like it just keeps my brain working, and it's a challenge to figure out, okay, it's not enough to say you have pelvic tension, and these are fabulous tools, but it's a disservice to leave it there and not figure out why that's there in the first place, and get you better.
Absolutely. It's really important that clinicians are looking all the way up the chain and all the way down and utilizing all of the orthopedic and manual skills that we have to address that, because the pelvic floor can drive issues down the stream. And certainly that great toe and ankle
Yeah.
can be stuff up every time we take a step or get in and out of our car or try to go for a hike or whatever it is.
Yeah.
I love it.
That makes it fun. And I think it often, women find it to be surprising, because, as you know, most people come in thinking they have this very weak, lax pelvic floor that's doing nothing to serve them, when it's so usually the opposite, right? We have more tension and then weakness, and then the problem solving that goes along with it. I love. And I think we're certainly getting a lot more social media attention to pelvic health, which is fabulous. And we have a long way to go, but this is so much better than when we were first starting in this area. And 4 or 5 years ago, nobody was talking about it.
I agree. I've been in public health for almost 16 years
Oh,
now,
wow.
and
Yeah.
massive growth in the last 5 years has been tremendous. We've
Yes.
really gained momentum. There's a lot more therapists available that are trained, and those of us that are trained are always learning and always trying to be better. So it's a good time to be a pelvic health therapist.
Yes. Yes. I've loved it. And my kids are a little bit older now. I have one starting college, another one that's a new driver. I know we have move-in date coming in soon, but it's a wonderful season of life to move into having my own practice and have a little bit more of that autonomy. And I feel like you've been a provider for a while, so you kind of really know yourself. And that it's been wonderful. Loved it. My family's really loved it as well. So it's been a huge blessing for us.
You are providing such a tremendous service to not only those in your area, but also everyone through your amazing content on Instagram as well. That's so educational, and the way that you pull in the nervous system and all of the lifestyle concepts just makes it so much more applicable. And um,
Thank you so much.
thank you so much for being here. For those that are not yet following her, go follow Jill. She's amazing. Jill, thank you so much for sharing your expertise and your time with me. I appreciate you very much.
Thank you so much. Pleasure to talk.
We'll see you next time.
Bye.
Bye.